Hi, my name is Julie Burns Christensen, and I'm the Democratic District Leader for District 52 in Multnomah County. This is addressed to President Obama, Senators Ron Wyden and Jeff Merkley, and Representative Earl Blumenauer. In the last number of years, we have worked hard out here in Corbett, Oregon, to get you folks elected to office. One of the reasons that some of our Republican neighbors voted for you this year, this last election, was because they wanted health reform. We've tried to go and have been to some meetings to tell you what we think, but we've been naysayed and yelled out of the meeting because of people who have misinformation about health care. Personally, I want to see universal health care for all people in this country because it's the right thing to do, because that's why I elected you. That's why I voted for you to do this. You're worried about how to pay for it? I have several suggestions. First of all, get out of Iraq. We don't need to be at war. We never wanted to go to war, and we need to stop that war. Secondly, why don't you stop having contracts with people like Halliburton who move out of our country in order to avoid paying corporate taxes? I don't think any government contract should be with a company who's not willing to pay U.S. taxes. Restore the taxes to the rich that have been cut since Reagan through the Bushes. We need to get some of that money back. They've got plenty of money to spare, a lot more than poor people who have no insurance. Finally, we pay a certain amount for our health care, and that money could go into universal health care. Also, you can bring back the inheritance tax. We're not expecting $10 million ourselves. One of the things that I wish you would do is stop taking bribes and money from health insurance companies and from pharmaceutical companies that help to blur why you're in Washington in the first place. You're in Washington in the first place because we elected you. We want health care reform. We hear this from everybody. I went to a rally on Saturday, and I was wearing this sign after the rally, and people on the Max line, people in Macy's, people at Lloyd Center were coming up to me, total strangers, and saying, yes, they wanted health care reform too. I think most Americans really want health reform. They want this badly, and a few people who have been paid off by health care have rallied ignoramuses around the fact that this would be a bad deal. We know that there are no death squads or death panels. We know these things. We want good, reasonable health care for all Americans. Thank you, and I hope that when you go to vote, you'll remember that we're the ones you're representing. Thank you.
Addressing also President Obama, Senators Merkley, Wyden, and Congressman Blumenauer. My name is Mary Blankavort, and I'm a precinct committee person for the Democratic Party up here in the Corbett, Oregon area. And this is a personal plea to you for guaranteed universal health care in this country, so that my hardworking but part-time colleague at the small business where I'm employed, a mother of 3 who does not work enough hours to qualify for our group plan and cannot afford health insurance on her own, does not have to wait until her children's illnesses are life-threatening before she takes them to urgent care, where she may or may not be able to pay. And of course, when she can't pay, then the rest of us pay for her. We need health care so that the families of the young cancer victims, like the ones Ted Kennedy encountered when his son was receiving chemotherapy, are not forced to sell their homes in order to afford treatment for their loved ones, not knowing at what point treatment might have to be terminated for inability to pay. Because Senator Kennedy's family was covered by insurance provided by the United States government, his son received treatment and survived. This contrast in care became a driving force for our late Senator's zeal. I strongly urge the administration and Congress to legislate for a health insurance exchange with a public option, which needs to be in place if for no other reason than to provide a guaranteed safety net through which no American citizen can fall untreated. Some critics say that we can't afford to do this. I say, and our responsibility for each other says, that we can't afford not to. Thank you very much.
My name is John Christensen. I live here in Corbett, Oregon. I'm a psychologist who's worked for 25 years in the healthcare industry, both in the training of resident physicians and in providing mental health services. I endorse completely everything that Julie and Mary have already shared with you, and I thank you for taking this time to listen to our concerns. This is a defining moment in our nation's history, and history will judge you, our elected officials, on whether you did the right thing at this time in this year to provide universal health care coverage for all Americans. It's a disgrace that we are the only industrialized nation that does not have universal coverage, and we have worse health care outcomes, both in infant mortality and in longevity, than many of the other industrial countries. I think it's going to be too costly for our generation and the generations to come not to provide universal coverage. An example is that providing health care for everyone promotes the health of all of us. Infectious diseases respect no income limits. So those who continue to have community-acquired infectious diseases and that are untreated because they cannot afford health insurance put everyone at risk. Moreover, it is the right thing to do for any truly enlightened society to take care of its most vulnerable people. I ask that in the healthcare reform that you pass, that you institute for Americans, that you also include funding to increase the primary care medicine task force. We are facing a crisis in primary care in this country, and unless the reimbursement rates are changed to allow more people graduating from medical school to go into these primary care specialties, the kind of preventive care that saves costs down the line will be denied to us. I also, on the same note, urge you to adequately fund mental health care, because untreated mental illness also puts people at risk for many diseases. Untreated depression, for example, puts people at increased risk for heart disease and diabetes. So again, I ask you to do the right thing. Give us what we have been waiting for generations: universal health care coverage with a strong government option. Thanks for listening.
Okay.